There have been many stories of survival against the odds during this pandemic, but few which span a stint in intensive care lasting 96 days.
Can I hear your voice?
Yeah.
Hello. How are you?
At Cardiff's University Hospital of Wales yesterday, finally, they moved Steve Jones from the intensive care unit to this step-down ward.
How long have you been in there?
In here?
Yeah.
97 days.
Oh, wow.
97 days since this 59-year-old window fitter from Barry arrived in hospital with COVID. Memories of that moment which he filmed and much thereafter now lost. What impact does not being able to remember those 2 months have on how you're dealing with this now?
I don't know, it's just a strange feeling, you know. I don't know, it's hard to explain. But it's had an impact, you know.
Lung damage, kidney failure, blood clots. The impact so severe he needed ventilation for 83 days. Steve Jones was on a ventilator when we first filmed him 7 weeks ago. Out of sedation into a fog of delirium, now unable to recall some images, others too indelible to forget. Very few COVID patients in the UK have spent so long in critical care.
Down there, just them walls. Oh, it was awful. Stuck in a room for 3 months in a bed. I've seen people pass in the, you know, in the same room, just scared. You know, you're lying there thinking, am I the next one, you know?
When we talk of his family, it becomes overwhelming. By his side are some of his critical care rehab team, Gemma Jones and Megan Lewis. Constant voices of reassurance, as they were in May when we filmed them fitting Steve with a speech valve.
It's really lovely to hear your voice. It's really strong.
Now sharing with him this glimpse into the progress he's made.
You know, where was my brain when all this was going on? Must have been somewhere else because I can't remember any of that. I'm out of it, aren't I?
We always bond with our patients and it's really important to have that kind of therapeutic relationship. But again, in the absence of family members, in a crazy time for us all professionally, people like Steve have kept us all going. And the reason we do our job is for people like Steve, and kind of it's been really nice to see his progress so far.
Thank you. Thank you.
Steve Jones has emerged from critical care after more than 3 months of profound change around him, and in a very significant week for the NHS in Wales. Monday was the first day since lockdown that no new deaths were reported by Public Health Wales. A major milestone, said the Welsh Government, which today found itself criticised in a parliamentary report for too slow a response to the pandemic. A pandemic which leaves a previously fit and active Steve Jones now 4 stone lighter, barely able to walk.
You can.
All of that.
And along with many of the more than 200 COVID patients in Wales who've left intensive care alive, needing extensive rehabilitation.
I think sometimes it takes coming off intensive care and onto the wards and speaking to someone like yourselves where it all maybe sink in. And I think speaking about family and remembering their lives before this 100 days is just a big thing for the patients. I think that's when they realise it maybe hits them how things have changed and the journey they have in front of them.
Steve, what are you looking forward to most?
Pint of Strongbow and a nice T-bone steak. I'll do for starters. And see my family, you know. Be home with my missus, kids, and...
That'll be quite a moment going home. A few more weeks to go, but Steve Jones is almost home.
Well, as Andy mentioned there, a report by the Welsh Parliament's Health Committee has said there were serious weaknesses in the Welsh Government's response to coronavirus. Care homes had been badly let down, the committee claimed, saying the initial approach to testing in care homes in Wales was flawed and that the testing programme as a whole lacked clarity. The committee also criticised the distribution of PPE. The Welsh Government said it didn't accept the finding that care home residents had been badly let down and insisted its approach had been rooted in scientific evidence.